So what's up, people? It's your boy OT and welcome to Steady Bro. When I told you the physician associate course was designed mainly to cushion the shortages of doctors, particularly in primary care, was I wrong? I asked this question because apparently the HEE, which is the Health Education England, is currently in the early stages of developing a new medical program. This program, unlike the traditional MBBS, is an apprenticeship, meaning students will be earning whilst learning. It has been so designed to broaden the access to medicine. And of course, these are early stages, so there's not a whole lot of information for one to go off. However, from what we know so far, it seems that it's going to last about 5 years. They'll be trained and expected to be at the same standards as MBBS students. That is, after a person finishes this apprenticeship, he or she can register for provisional medical licenses and then move on into the natural foundation programs and develop from there on. The scope of practice will be no different from that of traditional MBBS students. So basically, they are creating two ways for one to become a doctor. This, they say, will broaden and widen the access to medicine, especially with people with low socio-economic backgrounds. Though having the intellect and capability to pursue a medical career, their pockets aren't deep enough, and a 6-year or 5-year course would really hurt their finances. Now let me be clear, this is not a get into medicine quick scheme. You know those adverts on YouTube where they tell this is not a get quick rich scheme? This one is not get into medicine quick via some lungu route. You'll be expected to meet the same entry requirement, good GCSEs, good A levels in chemistry and biology. You get my drift? The news of this apprenticeship received mixed feelings in the medical world. Some doctors thought this was absolutely superb and would indeed tackle the shortages of doctors and also widen the access to medicine. Some argued, were physician associates not created exactly for this purpose, to cushion the shortages of medical doctors? Physician associates are now being recognized, patients, staff are getting familiar with the role. Will it not be confusing to introduce another medical role with a whole lot of explanations? Yes, I'm a doctor, but I didn't go to university. I'm an apprentice. So what's the difference between you and Dr. Mike? Well, Dr. Mike went to university. Does it mean Dr. Mike is better than you? Some felt that students trained under this apprenticeship program will lack the scientific foundation and background necessary for one to safely and competently practice medicine. The proposal says these individuals will be trained to the same standard, same rigor as medical students. If I'm trained exactly like you, why should I be any different from you? But some make this argument, and I think it's very interesting, that the training of junior doctors as it is right now in the NHS is already suffering. So it would be unreasonable to expect an individual to be taught the preclinical scientific foundation and clinical staff at the same time whilst learning on the job. And now the question is, who will be doing the teaching? Will this be carried out by consultants, or will registrars be expected to teach these individuals? Some advance the argument that the apprenticeship being decentralized will mean there will be inconsistencies in what people are actually taught during the apprenticeship. Others, though agreeing that access to medicine must be widened, felt that this apprenticeship does not tackle the question. They believe medicine is already a hands-on degree as it is already, because you have the 3 years preclinical and you have the additional 3 years if you're doing the 6-year course, or additional 2 years you're doing a 5-year where you're on the wards and you are learning on the job. So all this apprenticeship thing is not really the way to go forward. And if indeed the government is trying to broaden access to medicine for people from a low socio-economic background and from deprived areas, perhaps they should subsidize these individuals in undertaking the traditional medicine, unless the government has a cynical motive for putting up this apprenticeship. That which they advanced for was maybe because these individuals will be doing an apprenticeship, not a traditional MBBS, though they might be able to practice medicine in the UK, because of the lack of an MBBS degree, they will not be able to go outside of the UK and will be stuck in this country tied to the NHS. With regards to that, there is no evidence to indicate that, and these are just speculative rumors circulating. One thing I heard a lot is that this might be reminiscent of physicians and barber surgeons. Today, when we think of barbers, we think of getting our hair cut and getting some crisp hairline. First off, don't look at my hairline, bro. My thing is taking the lean back. When I went to PA school, my thing was crisp. I don't know what happened. I don't know if it was stress. I don't know, someone looked at me with the wrong guy. My thing is doing the lean back now. So to our barbers. Barbers back in the day did way more than we know them for today. They were like Figaro from the Barber de Sevilla. Sono il factotum della città. Sono il factotum della città, della città, della città, della città. That was Figaro. It was about Barber de Sevilla. Barbers were doing a whole lot more, as I said, from cutting hair to pulling teeth out, letting blood, trepanating people's car. You know what? They believed letting out blood was allowing the bad blood to get out of your body. They would drill holes in people's skulls, thinking this will let the demons out, and it was a cure for seizures. Bro, these men were just butchering people. It was a medicine. You might ask yourself, where were the doctors? Where were the physicians? Bro, back then, these physicians were found in the courts and palaces of the wealthy, and they were only providing their services to these individuals. Physicians were highly educated, speaking fluent Latin. Habemus papam trapanemus contincum avum. Veni, vidi, wiki. Now listen, so these physicians were highly educated and they deemed these gruesome surgical procedures to be beneath them. The average Joe could get their medical attention from the barber. Don will cut your hair, give it a nice trim. At the same time, he'll pull a tooth out for you. So they were factotums, they will do it all. Physicians, as I said, highly educated, were university trained, licensed. Barber surgeons were not. These guys had to join a trade guild and undergo an apprenticeship in order to practice the archaic type of medicine. There was like a two-tier medical provision. You had the educated physicians and you have the barber surgeons who were learning on the job. As secular universities became more common, around the 13th century, physicians started doing surgery. And you could distinguish between the two by the length of their robe. The physicians wore the long robes, while the barber surgeons had the short robe. So as medicine evolved and these archaic practices were left to the barber surgeons, began to fade out. And the nail was hit on the head when Louis, in I think it's 1743, passed a legislation. It was forbidden for barber surgeons to carry out any surgical procedures. And they were relegated to cutting hair and trying to fix my hairline. 2 years later, after that, the same thing occurred in England, and barber surgeons only dealing with wig and grooming, essentially. No more amputating legs, trepanating skulls. They were out of the medical field, and they were just limited to making man look good. So that is what some people fear this apprenticeship compared to university trained doctors will bring back. This will be a step back into the olden days. Now, my opinion on this matter. You see, personally, I think if a person can be trained to competently and safely practice medicine, how they got their training doesn't really matter. But I'll be dishonest and cruel if I denied the pressures junior doctors face in the NHS. So I can understand, I think more accurately sympathize with them, because I'm not a doctor, I'm a physician associate, in their frustration regarding this whole apprenticeship thing. And of course, it's early stages and there's not a lot of information to go about. These thoughts going about the internet are more gut reactions and how people feel. Sometimes when you feel burdened by the system, little things can be a thorn in your flesh. But I can sympathize with them. It's early stages, and I believe the relevant stakeholders will be consulted and your opinions be heard on the matter. However, the bureaucratic wing of medicine, and this is why I understand the frustration of these doctors, often at times seem out of touch with the realities individuals feel on the ward on a day-to-day basis. But of course, as more information regarding the apprenticeship comes and they might see some of their questions and their worries addressed, I think you'll be able to then have a more comprehensive discussion and maybe formulate proper opinions on what we think about the apprenticeship. So PAs, let me know. Do you think this will affect us in any shape or form? Do you think it's none of our business? It's just for the doctors? Let me know in the comment section. Hope you got something useful out of it. If you didn't get anything useful out of it, at least you know about barber surgeons now. No? It's your boy Yoti, and I'm out. Salute!